Okay, hello, welcome. I am doing a live stream with my new camera, so please excuse any technical glitches. Um, Today I'm doing an Ask Me Anything office hours, so let's get started. If this is your first time watching, welcome. I'm Dr. Meghan. I'm a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. If you're confused about your weight, if you have questions about weight medicine, and if you want medically based answers to weight questions, you are in the right place. So let's get started. Okay, more great questions. As always, if I can't answer personal medical questions, so if your question leans personal, I'm going to change it so it's more broadly applicable to other people. And so I'm not answering a personal medical question because I'm not your personal doctor. But I do love answering these questions. You guys have great questions, and I think we can all learn a lot from them. So if you have questions at the end, also please leave them down below. I post this on my YouTube video, Weight Medicine with Dr. Meghan, and so you can certainly leave questions for next time there as well. Okay, so first question, do you have an opinion about hormone replacement therapy and Mounjaro, bioidentical pellets? Yeah, I do. Great question. So, a lot of people wonder if there is like a weight management component to hormone replacement therapy. And what we have found and what the literature has shown is that they don't like hormone replacement therapy doesn't really work specifically as a weight loss tool. So it's not something we would prescribe for weight loss. It certainly does help with a lot of things that in terms of the perimenopausal period. But in terms of weight loss specifically, I wouldn't, you might see some weight redistribution. There are other benefits of hormone replacement therapy, but I'm not expecting anybody to lose like an extra 5 to 10% body weight by adding hormone replacement. If I was prescribing that for somebody, it would be to treat their perimenopause symptoms and not to help with weight loss. But that's a great question. Bioidentical pellets, I don't recommend. I mean, usually I rely on endocrinologist or a gynecologist in terms of hormone replacement therapy. I do prescribe it sometimes, but I also feel like we have great specialists that do this. And I always use FDA approved methods. I think when you get into there's like a gray area in terms of hormone replacement therapy. There's compounded lotions or creams or bioidentical pellets are not really regulated by the FDA. I don't recommend them. If you are interested in hormone replacement therapy, definitely talk to your primary care doctor, or if they have an endocrinologist or a gynecologist that they recommend you following up with, definitely do. But this is also bioidentical pellets are not like recommended by the National Society of Endocrinologists or anything like that. So there's lots of great FDA approved methods for hormone replacement therapy. There's many different types of it, and there's a lot available. So definitely it's out there, and it can be very effective for people, but you definitely want to make sure that you are doing it safely and with somebody who has a lot of experience doing it. So I would check in with your PCP, your endocrinologist, or your gynecologist and go from there. But I personally don't rely on it to help with weight loss. Next question. This is about side effects. The shakiness I'm having trouble with, especially if I eat carbs to the point I can't sleep very well. Okay, I think this is somebody on semaglutide or tirzepatide. Yeah, so I would say if you are having shakiness, for anybody who's having shakiness, you want to check in with your prescribing physician, because, and it also depends on whether somebody has diabetes that they're treating, the other medications that you're on. But one of the side effects of this can be from hypoglycemia, and that can cause some shakiness when your blood sugar is too low. So, and the risk of that is going to be worse if you have diabetes, if you're on certain medications. Generally, if people have overweight or obesity, but they don't have diabetes, it's not usually a problem, but definitely you want to follow up with and see if you can also, sometimes people will check their blood sugar at home, see what it's doing when they're feeling like that. But I would definitely look into that further. I think this is more of a sharing, which I love. Mounjaro has truly changed my life. I've lost about 20 pounds in less than 5 weeks. On 2.5, I'm trying to stay on this dose for as long as possible. Okay, I'm joining a gym this week. I primarily eat fiber and meat with healthy breakfast as well. I suffer from pre-diabetes, stubborn hypothyroidism, obesity, high blood pressure, sarcoidosis, asthma, and sleep apnea. It's done wonders for my inflammation as well. This medication has done wonders for my inflammation as well. I'm definitely going to do all that I can to lose 100 pounds and hope to remain on a small maintenance dose. Yeah. That's great. I mean, 20 pounds in under 5 weeks on the 2.5 is very encouraging, and there's no rush at all on these medications. You definitely, if you want to see how far, the 2.5 dose, how far your weight goes with that, I think that's fine, especially if you're having side effects. But also if somebody, if their weight loss speed is significant, I will also slow the titration down, because also what you don't want to do is like overshoot the mark. Obviously people are on this medication to lose weight. You don't want them to lose more weight than you agree is healthy. So if somebody, I do have some patients, every now and again this happens, because remember, it's a bell curve. So some patients are going to lose a lot more than the average. Some patients are going to lose a lot less or even gain weight. So if there's those patients on the end of the bell curve where they're losing a lot on a small dose, those are people that I like to go a little bit more slowly on, because you just might not ever need to go up to the high dose. And sometimes there's issues with insurance on that. Like, the insurance is usually more likely to cover the 5, the 10, the 15, as opposed to like the 2.5 or the 7.5 as a maintenance dose. But all insurance issues aside, sometimes you really just don't need to go up fast, and you don't always have to go up all the way as well. It's usually my goal that we are doing that, because that tends to be where people get the best effect, but not always. Thank you for sharing. That's great. Okay, this is a great question. I'm having better suppression, appetite suppression, I think they're talking about. Splitting my dose and injecting every 4 days or so. So much better than one weekly dose. Now, there are some pens, depending on what you're on, where you get multiple doses in one pen. It really depends on the type. I don't believe, let's see, I don't believe with Zepbound. I don't believe you can do that with Zepbound, but some of them you can. I think you can on Ozempic, Saxenda, you can. So you could give yourself half the dose. They're multi-use pens, so you're not, so on Saxenda you're changing out the needle and everything. But so you could, and I don't see. If you have no injection site reactions, no issues with the actual injection itself, then you could certainly try it. I haven't done that. I'd be interested. If you have tried it, let me know what you think. If you have one of the pens that can do this, don't do it on a pen that can't be used more than once. But if you do have a pen that you can do multiple doses on, and you've tried this, let me know if it worked for you. I'd be really interested to see, because some people feel worse the day after their dose, so they may not want to do this. But this is an interesting concept. And I'd be very curious to see if other people have tried it as well, and on those pens that you can do it on, and if they liked it, and if there was any added benefit to it. So thank you so much for sharing that. And that's going to do it for today. So thank you so much for watching. As always, you can catch this on YouTube, Weight Medicine with Dr. Meghan. If you want to work with me directly, you definitely can. And I'll leave that information down below. And thank you so much for watching, and please be well.